Good morning, everyone. My name is Beth, and I am with the Education Alliance. At the Education Alliance, our mission is to bring businesses and communities together to support public schools, and we are passionate about helping students explore career opportunities and develop skills they need for future successes. And one of the ways that we do that is through programs like this. This is our virtual work-based learning program, and we are connecting students with industry professionals to gain real world insights and experiences. And today I'm excited that we have the opportunity to partner with Q Labs, giving you a firsthand look at careers in this field. So without further ado, I'd like to introduce Chosky from Q Labs. Thank you. Good morning. Thanks for joining us.
Hey, good morning. How are you all? Um, I hope today to give you a brief overview of everything that we do at Q Labs and highlight a few of the careers that we have that maybe you'll be interested in the future. So I'll hop right in and feel free. I can't see you all for some reason. I can only see my presentation. So if there's a question, somebody just yell at me so I can try to answer it. Um, but let me tell you a little bit about myself. So I'm the director of marketing and sales at Q Labs. I got a degree in English education from Concord University, and I actually was a high school English teacher for about 6 years, and then I decided to pivot. I ended up getting my master's in healthcare administration from LSU, and I've been working in that field for about a decade. I've been married for almost 16 years. It'll be 16 years in July. My wife also works in the medical field. She's a provider. We have a 10-year-old son. We've got a poodle named Lily and a hairless cat named Luna. So, just a little bit about me. And then I'll tell you a little bit about Q Labs. So, let's see here. Q Labs. So, Q Labs is considered a clinical reference lab. And clinical reference labs, we test a wide range of samples. We test blood, urine, um, solid tumors, tissue, a lot of different things. But our job is to help physicians, hospitals, and other employers, criminal justice workers diagnose and monitor patients' health or their employees' health for a lot of different reasons. So, a lot of times we go to the doctor, we, get our labs drawn, but we don't really think about the process of how those labs are, resulted and received. And so that's what I'm going to kind of walk you through and all the different careers that are involved in running just a single lab test. So why do our labs matter? You may or may not know this. You guys are young and healthy, but we use a lot of technology in the lab space to provide results that help guide a doctor's treatment and decision making. And so, if you think about, a simple blood test or a simple urine test, that test is a diagnostic tool for your provider to say, hey, we need to prescribe you antibiotics or we need to prescribe you these steroids to kind of help guide their treatment. Without the labs that we perform, um, providers, doctors would kind of be shooting in the dark trying to test you. And while that may seem okay, there's a lot of repercussions that can happen just with what they call empirically treating somebody. So if a doctor just gave you some medicine, taking a stab at the dark, there could be some repercussions for you as the patient. So it's really important for labs to not only get those results back to the doctor in a timely manner, but also in an efficient manner. Likewise, we do a lot of testing for employers and the criminal justice system. And again, getting those results back in a timely manner and an efficient manner, that helps employers, hire people, make sure that they have a safe workplace. You definitely don't want a truck driver who's on drugs driving an 18-wheeler down the highway. And same thing with the criminal justice system. We do a lot of drug testing for probation offices or drug courts. And again, that either helps keep people on the streets. So maybe, they're on probation and they've been, fighting addiction for a while, but they're conquering that, and so that keeps them out of jail, or sometimes it puts them back in jail. So being very efficient and making sure that we're crossing and double checking everything is very important in the lab space. Any questions so far? All right. So let me tell you a little bit about Q Labs at a glance. So we're headquartered in Charleston, West Virginia, but throughout the state, we have three additional patient care centers. So our main lab in Charleston is where all the specimens across West Virginia, but also we work in about 13 other states clinically, and we work nationwide with our criminal justice partners. All those specimens get shipped overnight or couriered overnight to our office in Charleston. We are three additional patient care centers. We have one in Bluefield, West Virginia, Logan, West Virginia, of course, Charleston, and we're getting ready to open a fourth in one of the panhandles in the near future. We have about 50 plus employees, and that constantly is growing, thankfully. We specialize in molecular diagnostics, which I'll tell you more about in a minute, blood, toxicology, histopathology, workplace testing, and criminal justice testing. And like I said, we try to be very quick and reliable for our partners. So let me tell you a little bit about some of the testing that we do. So molecular diagnostics, are any of you all familiar with that term?
And I
Do you
need
guys feel
50
familiar with
seconds.
molecular
Please
diagnostics?
report to the cafeteria. Whitney Stapleton. Thank you.
No, go ahead and explain that to us.
Okay, sure. So remember in like kind of the peak of COVID, I bet a bunch of you had to have a COVID test. And that was a PCR or a molecular diagnostic when they put the Q-tip up your nose. And so it's a
Let me
relatively
interrupt you just for a second. That
sure.
was a good keyword for them. I knew that they actually knew what it was. They've done PCR before.
Oh, okay, great. Great. Yeah, molecular diagnostics is just another term for PCR testing. Um, so, traditionally, labs use cultures, and cultures are great, and they're kind of an inexpensive way to run certain tests. But there's some downsides to cultures. They have to grow, and a lot of times they're time and temperature sensitive. And so, if the environment is not quite right, something may or may not grow. Molecular diagnostics, as I'm sure you know, we test DNA and RNA to try to find, whatever the infection is, the pathogen, and it's not time and temperature sensitive. So a lot of times our PCR testing will pick up on co-infections that a culture can't grow. Um, it doesn't the pathogen doesn't have to be alive for us to test it, and there's a lot of other benefits that come along with it. So at Q Labs we do PCR testing for skin and wound infections. We also do STI and urinary tract infections, which is very helpful because it's a very simple collection method. It's not as invasive as some of the traditional methods. We also do your respiratory illnesses like your flus and your COVID. We do gastrointestinal problems and nail and fungal infections. All of these things, they can be very life threatening depending on what they are. And so, being able to not only test for multiple infections at once, not have to run the risk of cross contamination or something not growing, but also with this form of testing, we provide antibiotic resistance testing. And so, I may be resistant to a certain antibiotic, but you may not be. And so that report will tell the doctor, hey, Chosky's, resistant to this antibiotic. So the doctor knows not to prescribe it to me. Because if they did prescribe it to me, I would go home, I would take it, I would come back in a week or two and say, Doc, I'm not feeling any better. Which again is, wasting resources and wasting money. So that's another benefit to these molecular diagnostic tests. We also do toxicology testing, which is pretty straightforward. That's through urine or oral fluid, and we test for a plethora of drugs. We have to kind of always stay on the forefront of that because we do work with the criminal justice system, and many times, things hit the streets. Um, you know, they're constantly evolving, so we have to stay on top of that. Our blood testing, we do routine and specialty panels. And then histopathology, you may not be familiar with. It's tissue and tumor testing. And we have a histopathology lab within the space. And I'll talk to you more about it when I show you a picture of that. And like I said before, we do workplace testing and criminal justice testing. Any questions?
Do you guys have any questions? Yes, we do have a question.
Sure.
What testing do you do most often in the lab?
Could you hear that?
What tests do we do most often?
Yes.
Probably, I guess it would probably be a mix of blood and urine. Those are the most frequent because those are, you know, general health indicators. So, a lot of times we'll just get family doctors who are doing wellness checks on people, and molecular diagnostics and the histopath. Those are more specialty tests. So a doctor wouldn't necessarily order those every day. That was a good question.
Any others? Nope, we're good. Thanks.
Okay. So let me show you a few pictures and kind of walk you through some things. So this is our office in Charleston. It's right off of McCorkle Avenue, across from like downtown Charleston in the Regatta. Uh, the building is kind of broken up, so the taller side is more of our administrative side, and then the shorter side is more of the lab space. And I'll walk you through. Also in this building is our patient care center in Charleston. So, if you needed to ever have labs drawn, you could visit us there if you were in the area. So this is our main lobby. This is where most of our visitors come in, vendors who, working on something in the lab. That's where you're greeted. And then these glass windows to the left here, that's our conference room. And that's where we host visitors. That's where we have internal meetings, guests, that kind of thing. It's set up with all the technology so we can Zoom off of that big TV there. And we have microphones throughout the room to pick up so we can have these virtual meetings. I work remotely. If I worked in Charleston, I would probably be in there talking to you today, but I'm at my house. Then this is our administrative hallway. And so we have a small conference room there to the right. To the left and down the hall, we have several offices. That's where all of our administrative workers work. And it kind of wraps around that kind of box there in the middle. And I'll show you, and we'll talk a little bit about this, but some of the administrative roles at Q Labs that work on that side of the building. We have our executive leadership. So we have a CEO and a CFO. Then we have our middle management. So we have our HR director, who's also our general counsel. And he's actually an alumni of your high school. His name's Chris Dean. He told me to give him a shout out today. So he graduated from Wayne High School, I think back in '91, he told me. We also have a billing specialist, which is very important to the lab world because that's the person that works with your insurances and those bills. We have a client success manager, and she is the one who does a lot with our clients out in the field. Then my role, director of marketing and sales, and then we also have a compliance officer, and that individual is responsible for making sure that we meet all of the standards that we have to meet as a lab. There are a lot of different credentialing boards that we work with, and so she keeps us on our toes to make sure that everything we're doing is up to code. We also have account managers, which I'll talk more about later. We have billing support staff who support our billing specialists because that's a pretty big role. And then we have just general support staff, front desk workers, a facility manager, couriers, and IT personnel. So that's kind of all those different people, for the most part, work on this side of the building. And as you can see, it's carpeted because we're not processing any specimens. So we can have carpet and like furniture. We're on the other side of the lab. We can't have that. Any questions about that brief overview of our administrative team?
No.
Okay. So then this is just an example of one of the offices. I will give our owners a big shout out here. They worked really hard to make the space, bright and inviting and, kind of pay or employee friendly. So like the desks, they rise in lower so you can stand up and work if you want to. Nice big windows, nice fun colors. This is an example of our employee and kitchen break room. Full kitchen, stove, oven, dishwasher, the whole shebang. Um, Great space to unwind while you're eating your lunch. And then the next half is our clinical side. And so let me tell you a little bit about some of the clinical roles, and I'll highlight some of these here in a little bit. Um, so we have a medical director, and a medical director has to be a physician. This is the person who signs off on a lot of our clinical stuff. He doesn't work at our lab physically. He works remotely. We do a lot of sending information to him, and he reviews it, signs off on it. And that's part of that compliance thing I was talking about earlier. We also have pathologists who are also physicians, and they read and interpret a lot of the tissue reports that we send out. So they look at the report, or sorry, they look at the tissue specimen or the tumor specimen. They read it. They look for irregular borders and that kind of thing, and then they make their report, their finding, and we report that back to the doctor. We have our clinical lab manager. She's kind of oversees the entire lab. She's actually from the Huntington area. I think she went to like Parkersburg, but she's from, similar to your area. And then we have toxicologists. They're the ones who read and report out the drug tests. Some work in-house, some we have remote. Then we have various department heads. So we have people over the blood lab, the PCR lab, the histo lab. We have medical lab technicians, which I'll talk about in depth in a minute. Accessioners are the ones that initially receive the samples when they come in the evening. And I'll show you a picture of their space and kind of walk you through what they do. And then we have phlebotomist, which I'll also kind of highlight here in just a second. So the accessioning room here, that's what I mentioned, where the specimens come in either late at night or early in the morning, and their job is to sort everything out. So they sort the blood, the urine, the PCR, the tissue, and then they have to enter it. We have to log that we received it, and they're double checking everything. They're making sure that we have an ordering provider. That's very important, that we know who ordered the test. They're making sure that specific tests are selected. They're checking names, birth dates, insurance information, and they're entering all that into the system so we can track that specimen from beginning to end. And then they're flagging any issues that may ever be present, like sometimes missing insurance information or something like that. So very important. They're kind of our front gate to get the specimens. This is our histopathology lab. So like I told you, our histopathology lab tests tissue, biopsies, tumors, that kind of thing. And we have a histotech. And that is a career I'm not going to highlight today because I'm not very, very well versed in it. But I know it's a demanding job, and it's a job that's in high demand, because a histotech, he actually takes the specimen, the tissue, and he shaves it very, very finely. And then he makes a slide out of it. And generally, he casts that tissue in like a paraffin wax. So he makes it really, really thin so you can see through it. He molds it and puts it in this slide. And then he creates digital images with this digital microscope that our pathologists can then turn around and read. So it's a really interesting job. And I know that histotechs are very hard to find. So that may be something that you're interested in, and maybe a career that you can look into later. And maybe, if you ever have any questions, feel free to reach out and I can connect you with our histotech. This is our main lab. So this is where the majority of the specimens are run. So your blood, your urine, PCR, there's some little side rooms here where specific things are run as well, but that's our main lab. And this is our training room. So this is where we have training with our staff. So, all those different machines that you see in there, they have to be maintained. Or if we buy a new one, the maker of that machine may come in and train the staff on, how to run it, how to maintain it, how to troubleshoot things. So this is kind of where we do some of these big continuing education meetings for our lab side. And then cool feature, we have an employee gym. I'm kind of jealous I don't live closer. We've got all the cardio machines. We've got a great weight room. So just a great benefit of working for the company. And then this is our patient care center. So this is where if you as a patient walked in, you would come into our waiting room here, and then one of our phlebotomists on site would draw your blood or collect the specimen. Real quick, I just want to run you through how a specimen travels, and then I'll see if you have any questions. So generally, a doctor places an order, and after the doctor places that order, a phlebotomist or a collector draws that specimen. They collect it, however, whatever is required. Then at night, our courier team, they pick up those specimens and they drive them to the lab. And we have a whole little network of couriers. We also utilize FedEx and UPS. When it enters the lab, our accessioning team enters that specimen information. That was that big room with all the computers. From there, the specimen is passed over to the lab, and the lab staff processes and tests those specimens. After they test and process the specimens, then the report is reviewed and certified. And that's where your pathologists come in, your toxicologists come in, our medical lab director, she reviews some of those reports so that everything is kind of double checked again, and then it's reported out to the doctor. So there's a whole network just clinically that kind of handles your specimen when they go from the doctor's office through the lab and then back to the doctor. Any questions so far?
Actually,
Okay, yeah, we have one.
Okay.
where do you get your samples from? Like, how far away do they come into the labs?
Were you able to hear that?
How far away do we get specimens?
Yeah.
Yeah. So clinically, and when I say clinically, I'm talking about doctors' offices, hospitals, that kind of thing. We work on the East Coast in a 13-state range as of right now. And we kind of limited ourselves to that 13 state for the time being because especially blood, it's very sensitive. And so we have to make sure that sometimes it's refrigerated, it's frozen, it gets to us in a timely manner. So we have specimens coming, maybe as far south as South Carolina, Georgia, as far north, some northern Ohio counties that we work with, Pennsylvania, I'm trying to think as far north, and then we kind of go out west, Indiana, that kind of thing. So we have that. If you think of the East Coast, we cover most of the East Coast. We don't really go far up into New England, and we don't go as far down clinically as like Florida. Now, with our criminal justice and workplace testing, we can cover the entire country. So we have accounts in Texas, we have accounts in California, because urine is not super sensitive to temperature and time and that kind of thing. So we have a little bit of leeway there. So we ship stuff all across the country. Any other questions, or did that answer your question?
We have another question.
Okay.
What type of benefits do you offer at the company?
Could you repeat that for me?
Benefits offered at the company.
Benefits. Oh yeah. So we offer retirement. We have retirement packages for our team. Like I said, we have that on-site gym, which not only helps the employees stay healthy, but we also offer insurance. And so offering the gym and offering health insurance, that kind of goes hand in hand. We have a very generous paid holiday schedule. Trying to think what else. This would be the HR director, the alumni for your high school. He would have more in-depth information about that. Paid holidays. We do a lot of monthly celebrations. We try to have fun and do monthly celebrations for people's birthdays, or sometimes we'll just do it's National Pepperoni Pizza Day. We'll order pizza for the whole staff, something like that. So that's kind of the main benefits. I'm sure there may be a couple minor ones that I'm forgetting, but those are the main ones: the retirement package, the health insurance, and then, like I said, the gym and paid holidays. All right. Any other questions? If not, I'll move on.
Nope, we're good. Thanks.
Okay. So this is, again, just kind of an overall map of the careers that we just highlighted again. I won't go over this again, but you can just kind of see the overall scope of the careers at Q Labs. And we already kind of covered some questions. So I wanted to highlight a few of the careers at Q Labs specifically. So the first I wanted to talk about were phlebotomists. Phlebotomists are super, super important in our world because, number one, they're hard to find, especially hard to find a good phlebotomist, because they are our first line of interaction a lot of times with the patient and with the practice that we're working with. We have phlebotomists that work in our office, but we also have phlebotomists that we hire to work in specific offices. So, if we were to have an account that was busy enough, we'll put a full-time phlebotomist in that office. And so they are day to day the face of Q Labs. They answer questions, they problem shoot, they're dealing with patients. And, a lot of people have phobias with blood draws and that kind of thing. So they have to be, very patient focused. And so I think they're, to me, one of the most important jobs that we have because they are so customer facing. Um, so they collect blood and samples. The credentialing is a certification that you can get right after high school. A lot of times your VOTEX or technical schools offer that programs. They range in time. I think the most I've seen is maybe 2 years. But I think they have all different time frames. The average salary is between 37,000 and 50,000 a year, and you can move up to be a lab technician or have several managerial roles after some time. So, kind of the steps to become a phlebotomist: you have to complete your high school education or get your GED. You want to enroll in a phlebotomy training program. Like I said, many times at community colleges or technical schools. You have to complete a lot of clinical hours, and then you have to get certified through different organizations that credential phlebotomists. And then you start your job search, working in hospitals, clinics, or labs. One of the great things I think about phlebotomist is you can really, there's so many different areas that you can work in. So you can kind of find an area that meets your personality. So again, you can work in a lab, you can work in clinics, hospital setting. That's a little more fast paced. We have traveling phlebotomists that we pay, and they wake up every morning super early. They visit nursing homes. They visit different offices and recovery homes. So you can be a traveling phlebotomist, and you can also like work in a nursing home environment. So a lot of different settings that you can work in as a phlebotomist. Their work responsibilities generally include, of course, drawing blood from patients, preparing samples for testing. And, it's more than just drawing a tube of blood. There's a lot of attention to detail that's required because some specimens have to be spun down, some have to be frozen, some have to be refrigerated, some have to be left at room temperature. Some you have to draw in, different colored tubes. And if you don't, it gets rejected. So the phlebotomist job is very complicated because what we don't want to happen is a phlebotomist makes a mistake. Maybe they draw it in the wrong color tube. It gets back to the lab. The lab says, we can't run this because you drew it in the wrong color tube. And then the patient has to be called back in and stuck again. So paying attention, knowing your job is very, very important as a phlebotomist. You have to maintain some lab equipment. So again, having to spin down those tubes of blood or whatever, you do that in like a centrifuge. And then you have to ensure, of course, patient comfort. And sometimes it's a little more difficult. I've been in offices and people have just totally, had a meltdown over having their blood drawn or crying, or babies, or, young kids. And so it's no easy feat sometimes being a phlebotomist, but I think it's a great job. And I know that finding a good phlebotomist is like gold to us. And so, we try to make sure that we pay them well and, treat them well because, like I said, they are our first line of defense and first line of interaction with many of our clients. Do you have any questions about phlebotomy?
Yeah.
How many phlebotomists are there typically like each lab that you have?
Generally, we just have one. So if like at all of our different offices, we have a single phlebotomist. There are full-time phlebotomists, but then we also have what we call floaters that are stationed at our lab in Charleston. And so if one of our full-time, phlebotomists need to take off, we'll send a floater. They'd have a company car. They drive to the location. We'll put them up in a hotel if necessary, and they cover for that phlebotomist. If the practice is really, really busy, we may hire, a full-time and a part-time or two full-time, but the volume dictates that. Any other questions about phlebotomy?
No.
Okay. Well, the next career I want to highlight is a medical lab technician. So these are the men and women that run and process the tests. You have to have an associate's or a bachelor's degree, which we'll talk more about in a second. Their average salary ranges between 50,000 and 65,000 a year, but there are a lot of promotions available to become a specialist, to be a lab supervisor. I think there's other classes that they can take to kind of elevate, their salary and their role within a company. But that's kind of just the basic, like entry level. So to become a medical lab tech, which again is a very highly sought after position, we literally just hired somebody from, I think they told me Maine, who's going to relocate to West Virginia. And that was the closest person we could find. So again, not a bad career to consider. You have to complete your high school degree. You can do an associate's degree in clinical laboratory science or a bachelor's degree, which will get you paid a little bit more in clinical laboratory science. You have to have a lot of hands-on lab experience through internships and clinical rotations, which I know that we've had a lot of students who are currently enrolled in college getting their laboratory science degree come in and intern at the lab and work with our staff. So, a lot of hands-on experience that you're able to do while you're getting your education, which I think is kind of fun. There's a lot of different certifying organizations that you have to enroll with and meet their standards, and it's generally preferred by most of the employers. But then also in West Virginia, you have to have a state license. In other states, they don't require it, but in West Virginia, you do. Your work responsibilities include operating lab equipment to analyze all the different types of specimens, identify abnormalities and test results, and converse with other medical staff and physicians. And so one thing that we pride ourselves on at Q Labs is when a test comes back with a critical value, meaning that patient, could maybe potentially die if treatment's not received immediately, or whatever the case may be. Our medical lab tech, specifically our medical lab manager, will call the physician directly and say, hey, we've got this patient that you sent a test in for. The labs came back just now. They're critical. They're at these levels, and we wanted to call and let you know so you can reach out to this patient immediately. So, it's more than just kind of being behind a microscope. You also have to be a bit of a good communicator and a face to Q Labs. You also have to maintain accurate lab records and reports. And this is very important for the lab as a whole because we answer to a lot of credentialing bodies. And so if you don't have, good record keeping and good organizational skills to show like, hey, we've maintained our machines, we've run our validation tests, we've done all these things and we've kept a record of it to prove that we are legitimately running specimens, it could get the whole lab in trouble. So you have to be an organized person as well. You have to ensure lab safety and proper handling of specimens, of course. And then you work under the supervision of a pathologist, which is like our medical director. Any questions about a medical lab technician?
No, not right now.
Okay. All right. Last career I'm going to highlight. If you are not a sciencey person, you don't want to deal with blood and urine and all the things, you can be an account manager. Account managers, they are, again, a bit of a life force. They help bring in new clients, but they also manage those clients, which are very important. They help clinics, doctors, and employers get lab services. You've got to have great communication skills, organization skills, and problem solving skills. You don't have to have any kind of medical degree, but a degree, a college degree in business, communication, or even pre med degrees are positives. Their average salary base is between 60 and 80 grand a year, but there's a lot of opportunities for bonuses and opportunities to move into leadership and marketing roles. So, like I said, we covered a lot of this. The business, the marketing, the healthcare administration, and science backgrounds are all helpful. You can gain experience even early on, working in medical offices or clinics. Even now, if you could get some of those very base entry level job, maybe answering phones at a medical office. That's going to show future employers, if you're interested in becoming an account manager, that you can talk to the public, that you can, problem shoot, that kind of thing. You want to look for healthcare companies like Q Labs that value relationship building. Not every lab operates like we do, so you want to find the ones that deal directly with their clients. So that you have the people skills, the organizational skills, and a lot of your work responsibilities require a lot of travel. You help your clinics and providers set up lab services, and at Q Labs, we provide travel reimbursement and hotel stays and that thing for our account managers. You act as the main contact for your accounts, and so a lot of times when there's a question about something, you're the first person that doctor or practice is going to reach out to. You want to make sure that your clients understand how to order the test and the test that we offer. That's very important, because if the provider doesn't understand how to order the test, they may send it to us in the wrong tube, or they may order it inappropriately, and then we can't get reimbursed for it by the insurance companies, because the insurance company says, oh, they didn't order that in the right order. They ordered the second test first. So as an account manager, you have to be able to educate and explain all these different things to your offices. You coordinate with the lab. So again, going back to like those critical lab values, stat tests that have to be back in a hurry, you talk to the lab directly sometimes and say, hey, Dr. So-and-so really needs this test back. Can you, help me out? That's going to keep the account happy. So you deal with the lab, you train new clinics, and then you build relationships. And so as the director of sales, I go out with our sales team a lot. And, sometimes it's nothing really important. We go as an account, they're happy. We just sit there, we build relationships, we talk to staff, we may bring them cookies or something and train them a little bit. But it's really about building those relationships, because like anything else, another salesman, another account manager for a competitor may walk in tomorrow and try to poach your client. And so if we build that relationship with the nurses and the lab staff and the doctor, they're going to be less likely to leave, because they like us personally as account managers and as a sales team. And so again, this is a very important role to the life force of Q Labs, but it's a role that you don't have to be necessarily medically or science inclined to have that role in the company. Any questions about an account manager?
Yeah, there's one.
Okay.
What are like the job hours typically for this kind of job? Like, how long do you work in a day?
Yeah, it's pretty flexible. So most of our account managers work remotely, and the great thing about it is, some mornings, like I had to go to Nashville, Tennessee about 2 weeks ago. So I woke up at 5. I started my day. I drove down there. Um, Worked a full day, but then the next day, I worked like maybe 4 hours, and then I had the rest of the day off. So it depends on your workload for that day. Sometimes you get everything accomplished in a few hours and you can stop. Some days, like if we go to conferences and we're with our clients and we're entertaining them, you may run 9 or 10 o'clock at night because you're taking clients out to dinner and you're, again, building that relationship. So it varies based on the day. But there's a lot of flexibility, which is great, especially if you have a family. I have like I said, I have a 10-year-old son, so I can kind of work my schedule around if he's got a school performance or something like that. Um, so it varies. It depends on what you're accomplishing that day. Any other questions?
No.
Okay. So I think we're at our career activity. Were you able to, did that package arrive?
Yes.
Okay, great. I don't know if you have passed out those papers yet or not.
I did.
You did? Okay, perfect. So, what you have in front of you are two forms. You have a requisition form, which is how our orders come in. Now, a lot of people also do this digitally, but for this activity, we're going to just do it on the kind of the old school way with paper. And then you have a report. And so I've been saying through this whole presentation that attention to detail is very, very important. And so there are, let me look at my cheat sheet here. There are four irregularities or errors between what was on the order form, the requisition, and what's on the clinical lab result. And I want you to take a minute to try to see if you can find some of the errors, and then we'll talk about why that's so important to catch those errors, and what departments of the lab will catch, those errors. So take a minute and kind of compare what was ordered and what was reported, and we'll talk about it.
You guys can work together.
Errors and
Like errors between the two. Like this is the order form, this is the results, and there should be like 4 discrepancies between the two.
All right. Do you all think you found some of these?
Have you guys found any?
I found one of them.
Okay. Which
Okay.
one did you find?
I just found that they wrote her name wrong.
Yeah.
Yes.
That one too.
So they misspelled the patient's name, which can be problematic for a lot of reasons. Number one, it could be maybe you actually do have a patient also named Minnie Mouse, but spelled with a Y instead of an IE. So your doctor may look at this and think, oh, the other Minnie Mouse has these issues. So the spelling is wrong. And also insurance, when you try to get your insurance to pay for it, they'll reject it and say, this is not necessarily the right person. So our accessioning team and our lab techs, they have to double check those things through the whole process to make sure that the name is spelled correctly, because it can create a waterfall of problems if we don't catch that right off the bat. Also, again, there could be a lot of different Minnie Mouses in the practice. And so, date of birth, that's very important that we double check that as well. So on this report, the date of birth is correct. Did anybody find anything else?
On here it says she's fasting, but on the other thing it says fasting status.
Great. That was one of the harder ones. Yes. So on the report, or sorry, on the order, the doctor marked that she was fasting, but on the report, it was put unknown. And that fasting status, which means you don't eat before the blood is drawn, that helps the doctor interpret those results. And so by putting fasting unknown, which would have been a lab error on the accessioning side, that can really skew how the doctor looks at those results. So it's very important that we put that fasting status, again, paying attention to detail. You see anything else?
Anything else?
Was we looking at TSH testing?
Right? Yeah, no
We tested
TSH.
that, then on the one it's not.
Right.
Yes, great. So yeah, TSH, which is a thyroid test, it was not reported out. So that would have been a lab error. And a lot of times that order form is just full of check marks. And so you've got to make sure that as a lab tech that you're running every single test, and that's the certifier who double checks that report, that every test that was requested is ordered. And again, if you don't run it and then the report goes back to the doctor looks at it and they say, guys, you didn't report this out, I needed it done. By that point, the specimen's probably too old to rerun it. So then you have to call the patient back in, re-stick them, and it becomes a whole problem. So one little minor error from a lab tech can create a whole issue for the account manager, because then the account manager is trying to apologize and explain what happened. And then the doctor's frustrated and the patient's frustrated because they have to come back in and be restuck. So all those things, paying attention is really, really important. There's one more error.
There is an amnesia, I think you would have received provider information.
Missing provider information.
Yeah, the physician's name is not on that report. And so not having the physician's name on the report is problematic because some practices have a lot of providers. It also can come off as insurance fraud. So if we, return this to insurance and insurance looks at it and they don't see a physician name as an ordering physician, they may think that as a lab, we're just running tests and trying to do insurance. So it can be considered insurance fraud, which is important that we have a physician's name on it. So yeah, you guys did great. Those are 4 examples of different areas of the lab that have to pay attention. It was really hard to kind of come up with a activity that we could do virtually, but you all did a really good job with it. And I'm actually had a couple other minor ones, but I think we're running close on time. So I want to stop and see if you guys have any final questions for me. And I also sent you something for your teacher to give out to you after the presentation. So do you have any follow-up questions for me?
How long have you been working for Q Labs?
I started with Q Labs in 2018.
Another one.
How did you get this job? How did you find out about it and apply to it?
Well, it's funny. I personally know the owners, and so when they started the company, they were talking to my wife and I about it. And I started out. I was looking for a career change, and I started out as an account manager. Uh, and like I said, I worked my way up to marketing, and I started doing all their marketing, and then I became the director of sales as well. So I knew the owners, but I had to still put in my application and show my resume and work through, because they knew me, just as Chosky. They didn't really know me professionally, so I had to kind of sell myself for this role.
Anything else? I think that's all of our questions.
Okay. Well, like I said, I sent your teacher something, and hopefully she can pass it out to you whenever she's ready. But as the marketing director, I get a lot of control over our swag. So when I take our reps to conferences, I take different swag items to entice people to come over and talk to us. So I wanted to send you guys a little QLab swag, just because I don't know, I thought they were fun, and hopefully you guys will enjoy them. But
Yeah, they will.
that's all I have for today, and I'll turn it back over to Beth.
Thank you so much. What a great session we just had. so much information, and I love the interactive activity at the end. So thank you so much for sharing that. Students, thank you so much. You guys had some great questions. I know that this particular class, you guys are studying about various things in the medical field, and I know this was right up your alley. So I hope that this was a great session for you. And if there's any other questions you have, feel free to reach out to me. Your teacher has my contact info, and I can ask Chosky for more information or anything else that we might need. So just want to say thank you for everyone for joining us today, and thank you for such a great session. And we will be uploading this recording onto our YouTube so that we can share it with a variety of other West Virginia schools. So to access this recording and all of our other work-based learning recordings, go to educationalliance.org, and once you're there, find work-based learning. Have a great day, everyone. Thank you so much.